Hello, class. My name is Eric Salazar, and I will be going over alcohol addiction. What is alcohol addiction? Alcohol addiction is a common disorder that is also known as alcohol use disorder, AUD. Those suffering from this disorder will consume alcohol at a very high rate and quantity. There are various symptoms that someone with AUD could have. Some of these symptoms include craving alcohol, loss of control, and negative emotional state. This disorder comes with a long list of risks, but yet it is one of the most common disorders. The 2018 National Survey on Drug Use and Health reports that 139.8 million Americans aged 12 or older were past month alcohol users. 67.1 million people were binge drinkers in the past month, and 16.6 million were heavy drinkers in the past month. Causes of alcohol addiction. There are several possible causes of AUD and many risk factors as well. In terms of causes, there are genetic, psychological, social, and environmental factors that play a role. No one knows how any one person will respond to the use of alcohol, so it is very important to gauge and monitor yourself and your loved ones when under the influence of alcohol. Some of the risk factors for this disorder include, but are not limited to, family history, history of trauma, social and cultural factors, and depression and other mental health problems. These risk factors can also be seen as causes depending on the person. An estimated 15 million people in the United States have AUD. Common comorbid disorders. It is quite common for people suffering from AUD to also be suffering with other comorbid disorders. According to the article, onset of alcohol use disorders and comorbid psychiatric disorders in the military cohort. Are there critical periods for prevention of alcohol use disorders? In psychiatric epidemiology, decades of research have documented that alcohol use disorders, AUD, including both alcohol abuse and dependency, are commonly comorbid with anxiety and mood disorders in the US population. Nearly 1 in 5 individuals diagnosed with a past year AUD has a comorbid anxiety or mood disorder. Effective treatment modalities. Today, there are so many more treatment options available for those suffering from AUD. While Alcoholics Anonymous and rehab are two of the available options, they are no longer seen as the only two options. Firstly, there is therapy that those suffering from this addiction can partake in. There are also medications that can be prescribed that can help people stop drinking and avoid relapse. It is important that those deciding that they need help find the path that works best for them. These can range from outpatient services to residential or intensive inpatient options. About 7.9% of adults who had AUD in the past year received treatment. This number is far too low. More people need to be able to get the help they need. Science behind AUDs. According to the article, theoretical frameworks and mechanistic aspects of alcohol addiction as a reward deficit disorder, written by George F. Cobb, who is the director of the National Institute on Alcohol Abuse and Alcoholism. The compulsive drug seeking associated with alcoholism can be derived from multiple neural adaptations, one of these being the construct of negative reinforcement. The negative reinforcement comes from chemicals in the brain that are typically associated with reward and stress to not be regulated like it should. The combination of loss of reward function and recruitment of brain stress systems provide a powerful neurochemical basis for a negative emotional state that is responsible for the negative reinforcement driving at least partially the compulsibility of alcoholism. Theoretical Theoretical issues surrounding diagnosis and treatment. Some of the things that one can expect to see in my experience when someone with AUD is the following: withdrawals, agitation, denial of fear, relapse, increase in depression, anxiety, stress. Reflection. After going through the sources that I looked through for this research, I am able to increase my knowledge on the consequences, hardships, and treatment options available for those who deal with this disorder. Since I will be working with adults in my future practice, this is a disorder that I will probably have to work with frequently. I learned a lot about the grim truth of this disorder and how more widespread than I and probably many others understood the disorder really to be. I hope that I have been able to provide you all with a lot of information to help your understanding of this disorder grow as well. My references are listed on the next slide. Please feel free to do some more reading on your own. There is a lot of good information in these sources.